And you also mentioned people that were breathing, that were having heart problems, and that they may end up with balance problems because they're weaker.
Right.
You've also worked with a lot of patients who have COPD. They have breathing problems as part of our Breathe Easy program.
Right.
So similar kind of therapy to
Yes.
help them with balance?
Yes, because we think sometimes, well, I have I have a lung problem. Well, oftentimes you don't just have one problem. Unfortunately, people who may have a lung problem also end up with a balance problem because of inactivity. So in the evaluation for the Breathe Easy program, we'll include balance assessment in that program. And as we teach them breathing techniques and energy conservation techniques and ways of coping with lung disease or congestive heart failure, we also incorporate balance training so that we can reduce the risk of falling and maybe improve their balance and their walking stability along the way.
So how long is it typical, you've told us all different kinds of reasons people could have balance problems and be falling, but how long is a typical treatment program, and does insurance cover this?
Insurance definitely covers physical therapy for balance and walking gait problems. And a typical program can really vary. If there's somebody that wants to do a simple program, learn some exercises, and is really diligent and dedicated to practicing at home, they can be seen less often and possibly conclude their program in a matter of weeks. Some people need a little bit more help. Maybe their balance problem is a little more significant, and it could take 6 to 8 weeks, or even maybe 12 weeks at times, really depending upon how often has that person been falling, how high is their fall risk, and if they're showing an improvement, we want to keep going so we can reduce that fall risk further.
And then you graduate lots of your patients onto the wellness program that you supervise.
Right, and that's really rewarding to see, because then they're with their friends, they're exercising in a group of people, and they participate in pool classes, and what they find is that once they've been able to incorporate exercise as part of their daily life, they realize that it's not that hard and it's kind of fun to be able to maintain their fitness and their health in that way, and in turn have less risk for falls and be independent longer.
So how does somebody begin?
So you begin by giving us a call at McLean at our outpatient department, and what you can do is you can ask for a telephone screen. We can just give you a call back if we can't talk to you right then and there, give you a call back and take a quick 10 minutes to get an idea of what your balance concerns might be, and sometimes just with a phone call we can determine, without even seeing a person, that they might benefit from physical therapy for balance, and then what we would do is speak with your doctor and ask for a physical therapy evaluation order to do a full balance assessment, and then develop an individualized treatment program for you.
Thank you for watching this show entitled Steady on Your Feet. We began with Eric, our physical therapist who specializes in vestibular program, and he explained what vestibular rehab is, or for most of us we call it vertigo, how he identifies it, what he can do to help those who experience vertigo with all of his equipment, and often, as he said, it's a very simple one-time treatment. And you heard Jessie explain what happened to her and how it's totally changed her life. And I'm not sure that she explained that now she's a hospice volunteer and she has the flexibility and confidence to do that with McLean because of this simple treatment. So if you experience vertigo, or you know someone that does, please tell them they don't have to live with it, that they should give us a call at 860-658-3745, and we can work with the physician and see if Eric can be of help. But as Dot said, if you don't have vertigo, but you are having balance problems, you are finding that falling is becoming a worry, maybe you're not even falling, but you worry about falling, then please, again, call McLean. We can come in with home care if you are housebound, or you can come to our outpatient clinic here in Simsbury, and we can help you stay steady on your feet. Don't accept balance problems and falling as part of normal aging. We want to keep you safe and independent as long as we can.